Well, it's 9 o'clock and we want to be respectful of everyone's time. Thank you so much for being here this morning. As we get started and as we're all kind of gathering, we also just wanted to be mindful that we are unfortunately once again gathering at a time where there are many communities who continue to be impacted by firearm violence across our country. Certainly we saw in the news yesterday around Kansas City. That's something that strikes close to home for us here in Denver, but also just in Denver yesterday afternoon. And so we just wanted, before we started, just to acknowledge that. And yeah, stay in that fight together. Okay, so we are very fortunate that we will have live interpretation for this presentation. And at this time, I want to invite our colleague Valentina from the Community Language Cooperative. You're going to hear her speaking in just 1 second. She's going to tell everyone how live interpretation for Spanish works. If there's anyone in the room who would like that, please just go to the back of the room and one of our CHIers will make sure that you can get connected. So Valentina.
Thank you so much. Hi, everyone. Good morning. My name is Valentina, and I'm here on behalf of Community Language Cooperative, and I'm here to provide and guarantee your commitment to language justice. Language justice is a type of simultaneous interpretation that seeks to create spaces in which no one language is dominant, spaces in which everyone can participate in the language of their heart. So to achieve this objective, we will be using Zoom's interpretation. And what you will see in a couple of minutes is that a new little button will appear on the bottom bar of your screen that looks like a globe. Once you see this new little button come up, go ahead and click on it and select either English or Spanish as both the language that you will be listening into and speaking into. For those of you that do prefer to use English, please keep in mind that Spanish is 20 to 25% longer than English, so please be aware of your speed. Buenos días a todos, a todas y a todos. Mi nombre es Valentina y estoy aquí por parte de Community Language Cooperative y estoy aquí por ofrecerles y garantizar su compromiso en la justicia del lenguaje. La justicia del lenguaje es un tipo de interpretación simultánea que busca crear espacios en los que no dominen ningún idioma, espacios en los que todos puedan participar en el idioma de su corazón. Para lograr este objetivo vamos a utilizar la función de interpretación de Zoom. Lo que verán en un par de minutitos es que aparecerá un nuevo botón que parece un globo terráqueo en la barra inferior de su pantalla. En la barra donde tienen los botones para el micrófono, para el video, para el chat, etc. Cuando vean ese botoncito aparecer, hagan clic en él y seleccionen inglés o español como el idioma en el que van a estar escuchando y participando. La interpretación es simultánea, esto es un breve recordatorio, entonces cuando participe, si lo hace, mantenga un ritmo de conversación. Si tiene alguna pregunta o alguna duda con esta tecnología, por favor comuníqueselo al grupo completo a través del chat o a las personas que están en vivo en la conferencia. If you have any questions or any issues whatsoever with this technology, please let the whole group know by means of the chat box or with the people helping out, the staff in the space. Thank you so much for having me here. We can go ahead and start the interpretation channels now.
Thank you, Valentina. And thank you to the Colorado Health Foundation, who has not only sponsored this beautiful space, but also allows for us to really have many accessibility options. But they're also the lead sponsor of the CHAZ, and they have been for the last 2 CHAZ cycles, so in 2021 and 2023. And it is fair to say we could not do the CHAZ without their lead sponsorship. So very grateful to them. And would like to invite our Senior Program Officer, Liz Charles, up to say a few words.
Good morning, everyone. Welcome to the Health Foundation if you have not been here before. As Sarah said, my name is Liz. I use she, her pronouns. I'm a senior program officer here at the Foundation overseeing our strategy and funding portfolio for primary care and adult recovery. And obviously, it would not be news to any of you, all the ways that our priorities across the Foundation intersect and overlay with one another, and how we work to use information, data analysis from the CHAZ to inform our priorities and the ways that we can build momentum, be responsive in our funding strategies. And we also appreciate so much the way that the CHAZ helps you all inform your practices. To hear directly from community is central to actually being able to be effective in those communities to ensure that we're centering the voices of those most impacted and those therefore closest to the solutions to the problems that we are collectively seeking to address. So glad you're here to nerd out with us, and so grateful for the team at CHI for all you do. And I know, you know, the time is so crucial right now for us to build kind of this collective impact, this collective power to address. I mean, we're talking about a public health emergency on wine. We're talking about Medicaid disenrollment. We're talking about influx of migrants and refugees that need specific, unique, targeted, intentional care and services. And, what better way to really understand those needs and the complexities of the areas that we work in than with this data. So thank you for being here. And without further ado, I'll turn it back over to you all.
Let's give the Health Foundation a round of applause. Thank you. All right, I'm going to try this mic for a sec. We'll just see how it goes. Okay, in addition to the Health Foundation, though, there are many, many public and private partners who make the CHAZ happen. And those folks are listed up here on the screen. I'm hearing that maybe the handheld mic is better. All right. So if anyone is on the screen here and you are in the room, I know who you are, but please raise your hand so that others can know who you are. Thank you, Carrie. Thank you, J.K. Stedman. See, we've got some people. Thank you. Everyone, wave hi and give them. The CHAZ is, it's a state asset. It's a resource that we all use and depend on. And again, we're just so grateful for everyone who supports the work. And speaking of gratitude, before we get started, I want to really give a heartfelt thanks to the CHI team who has just made this happen. Primarily Lindsay and I will be up here, but our communications team, Christy Ariano, Deanna Galdines, Biani Bermudez, Joe Hannell, and the roving Brian Clark up front. Please just wave your hands and everyone please give them the applause. Because Lindsay and I will be up here today, but really everything you're seeing is theirs and have really just made this, they make the CHAZ shine and really speak to everyone in the room and the over 300 people who are on Zoom with us today. So very grateful to all of you. Thank you, Team Comms. Okay, so who am I? I'm Sarah Schmidt. I'm the president and CEO of the Colorado Health Institute. I've been at CHI for 12 years, which means I've seen a lot of CHAZ releases, but this is the first time I've had the privilege of being part of a CHAZ release as the president and CEO. So it's a special honor for me this year, joined by my colleague.
Good morning, everybody. I'm Lindsay Whittington, and I'm the data and analysis manager at CHI. I've been here for a little over 4 years, and this is my second CHAZ that I've been a part of, but this one's especially special because I got to become the principal investigator of the CHAZ in this next year. So very proud of this work, proud of my team, and really excited to be here.
Thanks, Lindsay. And if you're not familiar with who we are, the Colorado Health Institute is an independent and nonprofit public health institute. We have been serving Colorado since 2002, providing evidence and analysis and data and insights to support the work that you all do. The CHAZ is really a critical component of that work, and we are all so excited to be sharing what we've learned, and then to see where you all want to take it from here. This is the 15th year for the CHAZ. As some of you, since 2009, the CHAZ has been a trusted source of providing consistent and trendable information on issues like coverage, access, the uninsured rate. It's a representative survey of 10,000 Coloradan households. I won't go into methods, but we have data from 2009 to be able to provide important and meaningful trends. And we're going to look at a couple of those trends on this presentation here today. The other piece of the CHAZ, though, that is important and makes it special is that we also collect demographics. So we have the ability to do crosstabs on things like race and ethnicity, age, geography, and income. We're also going to show a couple of those examples today, but in many ways, it's that crosstab, being able to look at the relationship between the questions on the CHAS and then people's experiences and sort of who they are and where they live that yields some of the most exciting and meaningful insights. But we also know that the CHAS is flexible. And so we have kept up with the times and really listened to all of you to hear what are the issues that are important to you, and making sure then that we are adding questions as we can and are able to track those issues. And now I need to make sure I'm looking at these topics. So these are some examples of the new topics that we added in 2023. I will read them. Broadband access, sources of healthcare information, reproductive health, awareness of assistance programs, long COVID, transportation, and climate impacts and preparedness. We identified these topics, again, really in conversation with many of you and in paying attention to what is happening within our state and within our health policy ecosystem to make sure that we can be responsive. We're going to talk about a couple of these topics today, but we won't cover all of them. So if you have a favorite that we don't get to today, Lindsay is going to share in a few minutes about all of the amazing information that is actually already on our website and more to come. So this is just the beginning. Okay, so here's what we're going to talk about. We're going to cover 8 topics. We're going to start with insurance coverage, mental health, climate change, housing, food security, affordability, disrespect in healthcare, and long COVID. If you attended our December 2023 Hot Issues in Health Conference, the first 4 topics may look familiar because we did a quick sneak preview of some key data in those 4 areas, but we have been spending much more time with the data and we'll be taking a deeper dive in those first 4 topics, as well as the additional 4 that we're covering. So we have a lot to share with you today. Just a couple of things to flag before we dive in. We will hold questions till the end for both people in the room, but also if you're joining us virtually. So jot your questions down or feel free to type them in the chat if you're online, and we should have time, yes, to answer those questions. Okay. We're calling this year's CHAS a moment of truth. I know, we're watching the Zoom things pop up. It's so distracting over on the side there. The 2023 CHAS really provides us with this unique post-pandemic view of understanding what is going on in Colorado. And I mean that in 2 ways. On the one hand, the 23 data really show the impact of policy and what happens when we put policies in place, but at the same time, what happens when we take those away. And we're going to look at a couple of those today and just see what has happened as a result of some of those changes. The second piece of the CHAS that is meaningful with the 23 survey is that it helps us make some sense of what we saw in 2021. And was 2021 this unique sort of point in the middle of the pandemic? Or was it actually something that was a beginning of a worsening trend or a growing trend? Or was that a pivot point for us? And so again, we'll see some of that as well too in the data. We're going to share some challenging results. And it has been a little bit of a struggle for some of us on the team as we're pulling this together, because we really like to have a balanced presentation and really highlight the positives that we are seeing, as well as some of the areas where we need to make some changes. But we also need to be honest, and we really want to just share where we are as a state right now. Where are we in 2023? That's our moment of truth. And then it really becomes up to all of us to decide what we want to do as we move forward with it. So we're excited to get going. All right. So we are going to start with insurance coverage. All right, so here's our first trend line. This graph shows the uninsured rate since we started the CHAS in 2009. We started in double digits early in the CHAS, but then dropped to about 6%, between 6 and 7%, following the 2015 Affordable Care Act expansions. We, of course, held steady through the pandemic. You can see that trend line on the slide. And our 2023 results find an uninsured rate of 4.6%. That is the lowest uninsured rate that we have had since we have started the CHAS. Now, despite the applause, this is good news. We just want to flag a couple of things for everybody, in particular, some timing concerns. So you'll see a timeline on this slide. We were in the field for the CHAS between, as you can see, between March and September of 2023. At the same time, beginning in May of 2023, Colorado joined the rest of the country in redetermining Medicaid eligibility following the end of the public health emergency. Prior to that, when we were in the PHE, or the public health emergency, the federal government required all states to keep everyone enrolled in Medicaid who were eligible and had gained coverage during that time period. So you can see we've got a little bit of a timing issue here, knowing that these things, that these issues, the redetermination is underway and will continue through 2024. Now, we know that a lot of work is happening. Many people in this room right now and people joining us online are very, very involved with outreach and ensuring that people are finding ways to gain coverage should they become ineligible. But we really don't know through this process how many Coloradans will perhaps have gained coverage through a different source or perhaps may become uninsured. I think the only thing that we can say with certainty about the redetermination process in the CHAS is that the CHAS is not reflecting those activities right now. We believe that we will need future CHAS data, so 2025 is really going to help us understand what has happened as a result of the redetermination process. So I appreciate the applause, Michelle. Thank you for that. But just some context for everyone, knowing that this is really top of mind. But let's see what we found in 2023. So this graph shows how Coloradans get covered. The bottom bar is 2019, we have 2021 in the middle, and then 2023 on top. Want to point out just a couple of data points here. So first you see, in the dark blue bars, those are the percentage of Coloradans who are enrolled through employer-sponsored insurance. We were over half in 2019. We dipped to just under 50% in 2021, but we held steady with ESI, or employer-sponsored insurance coverage, in 2023. The purple bar shows the percentage of the population enrolled in Medicaid. So in 2019, we were under 20% at 18.7. We saw an increase during the pandemic, of course, to 24.8%. And then we saw another increase in the 2023 results to 30% of the population enrolled in Medicaid. And then lastly, on these orange tabs, this is the uninsured rate. So again, you see 6.5, we see 6.6, and then we drop to 4.6 in 2023. We want to just take a closer look for just a couple more slides at that 4.6%, understand who's in it, where do they live, and why don't they have coverage. Okay, here's our first map. So just to orient you to the map. So the CHAS provides data for the 21 health statistics regions. You see those regions outlined on the map in dark black. And this map shows the uninsured rate by health statistics region. The darker the shade, the lower the uninsured rate. So again, you see in some areas in Northeast Colorado, Southeast Colorado, and areas along the Front Range, we have some of the lowest rates of uninsurance. In those lighter shaded areas, we have higher rates of uninsured. So this health statistics region, Garfield, Eagle, Pitkin, Summit, and Grand, has our highest rate of uninsurance. Now, I will point out that we have several counties that are hashed out. And in those counties, we actually had too small of an uninsured sample size to be able to provide a reliable estimate. So those are shaded. And that is the first time we have ever encountered that on the CHAS. All right. So the CHAS also provides us with important insights on race and ethnicity. And this slide shows the uninsured rate by several, not all, but a few races and ethnicities. And we see here that Coloradans who identify as Hispanic or Latino are more likely to be uninsured. So they had a rate of 8.9% in 2003. That's that dark blue bar. And you see that compared to 3% for white Coloradans and 2% for Black or African American Coloradans. Now, I want to flag that we have other races and ethnicities represented in the CHAS. This was another instance where we had uninsured sample sizes too low to be able to provide a reliable estimate. And last one on this is why people don't have insurance, and it's just too expensive. We ask on the CHAS why people don't have coverage, and they can select multiple reasons. You can see them here on the screen, but I'll point you to the first one. It says cost is too high, and over almost 90% of those who are uninsured said that that was the reason why they were not insured. It was too expensive. There are a couple others I want to point out. Just about 1 in 4, so 25.7% of people who don't have coverage say they don't have it because they don't know how to get it. We also have just about 18%, 17.9, who don't have coverage because they feel that they don't need it. All right.
The handoff. All right. So for our next section up, we're going to talk about some key metrics in our mental health section on the CHAS that we have available. And kind of the overall finding here that we found was that mental health challenges didn't go away as the pandemic eased. And we actually found some similar findings comparative to what people were experiencing in 2021. So for this first figure, we're outlining 2 very important mental health metrics that the CHAS captures. And for the very first one, which is up here already in green, this describes those who reported that they had poor mental health. And we have this tracked between 2013 and 2023. So we have a decade of this information. The second one outlines those Coloradans who reported that they weren't able to get mental health care services, excuse me, when they needed them in the last year. So when we track these 2 metrics over time, we can really see, especially in the last couple of years, this increased need and demand for mental health care services, especially after the beginning of the COVID-19 pandemic, where we saw a significant increase between 2019 and 2021 data, as well as, in 2023, we found a pretty similar rate of poor mental health at about 1/4 of Coloradans reporting, which was similar to 2021. So we're going to look at this poor mental health rate and really see who's more likely to report experiencing this issue. So just like Sarah mentioned, the CHAS captures a lot of really important demographic characteristics that we can analyze to understand some key differences for individuals in Colorado. So this first one we looked at was by age. So what we found was that many adults between the ages of 18 and 50 were experiencing pretty high rates of poor mental health compared to some other age groups in Colorado. And some of this might also speak to their willingness to actually speak about their mental health, as we know that different generations might be more comfortable actually speaking about their experiences. But we also know that many adults were experiencing some serious financial and other social stressors after the beginning and since from the COVID-19 pandemic. The next demographic that we wanted to analyze, we have some information on the CHAS about different identities in the LGBTQ+ community in Colorado. So this figure compares those who identified as straight and cisgender, up on the slide. Let me push this button. Okay, I'm too tall. Let me lean down. Okay, never mind. Technical difficulties. Okay. Oh, wait, it's back. Okay, here, take this one. All right, pause for dramatic effect. Okay. So back at it. So this slide compares the poor mental health rate between the LGBTQ plus community, which is on the right-hand side of the screen, for those who are straight and cisgender. And what we found was that those within the LGBTQ plus community with an identity in the community were more, they were more likely than their straight and cisgender counterparts to experience poor mental health, where we saw about 50% of the LGBTQ plus adults reporting experiencing these issues, compared to about 28% of those who are straight or cisgender. And so, okay, well, I'll just bend down. Okay, so we're not stopping here. We're actually going to be completing a more in-depth analysis of this population. Do we have a third? Oh, another one. Okay. Okay. Here we go. Okay. So we're going to do a more in-depth analysis of the LGBTQ plus community, which I'm really excited about. And I think okay, we're going to do a more in-depth analysis of this population and understand more about other metrics on the CHAS, about how they experience different behavioral health metrics, access to care issues, as well as lots more information, because we wanted to do a deep dive into this population in Colorado. Okay, I made it through that. Yeah.
All right. I don't trust this, so I'm going to talk loud, but that means I don't think I'll be able to move around, which is maybe better. Okay. For the win. Thank you. All right. Thank you. Thank you, Samba. All right. 2023 was the first year that we included questions related to climate and health on the CHAS. And our takeaway is that Coloradans are experiencing negative health effects due to our changing climate, but they're not totally confident that their communities are prepared to deal with these challenges. So nearly 2 million Coloradans said that climate change impacted either their health or their family's health. And you can see on the slide some of the impacts, some of the effects that individuals identified. So nearly 2/3 talked about respiratory illness or problems breathing. We also have about 1/3 who cited mental health or substance use impacts as a result of a changing climate. And then just over 1 in 10 identified worsening chronic illness as a result of climate-related issues. We also asked a question about how prepared Coloradans felt their communities were to respond to climate disasters. And you can see on this chart here, it's a mixed bag. In the yellow bar, we've got 47% of Coloradans said, my community is not prepared or is only somewhat prepared. We had the same amount, 47% here on the green, that said, my community is moderately well or very well prepared. So again, it's kind of split between how Coloradans feel about preparedness. But we know that this yellow bar, this 47% who says, no, we are not ready, we know that we thought that would vary by geography. And in fact, we were right. So we want to show you what that looks like. So again, this is a map of the 21 health statistics regions, and it shows the percentage of the population in these regions who said, my community is not ready. It is not prepared or is only just a little bit prepared. In the lighter shaded areas, you had more Coloradans concerned, more who were saying we are not ready. And you see that primarily in Northeast Colorado, sections of the Front Range, and then down here in Southeast. Now, the darker shaded areas, you had fewer Coloradans who had concerns about preparedness. And we see that primarily on the west slope, in our mountain area, and also in some of our mountain communities here too. So again, important insights for all of us as we're thinking about preparedness at a local level.
All right, so our next section is going to take us through one of our first affordability sections that we're going to start walking through together. And this one is about housing. As we saw that Colorado saw a little bit of a slide backwards in 2023 after some improvements in 2021 in housing issues. So this first figure looks at those who said they experienced unstable housing issues. And on the CHAS, we define unstable housing as those who reported that they were worried that in the next 2 months, they wouldn't have a stable place to live. So this figure also compares this issue by home ownership. So in the middle bar between 2019 and 2023, the blue bar, that is the Colorado average for this estimate between those 3 years. The green bar is those who own their own homes, and the red bar is those who rent their homes. So those who rent their homes were 7 times more likely to report experiencing unstable housing compared to those who own their homes. So when we think about the housing issue in Colorado, it is overwhelmingly a renter's issue. But although we saw some improvements in 2021, kind of a dip between 2019 and 2021, we can see that all 3 of these populations, it increased in 2023 to pre-pandemic levels. So housing and affordability issues around it is so important that we added an additional metric on the 2023 CHAS, and that is those who reported that they had issues paying for their rent or mortgage in the last year. So that metric is outlined in orange. And we have both of the affordability metrics on this graph. So in purple, those are those who reported that they had issues with stable housing. And again, the affordability issue that we added is in orange. So for example, we know that this issue doesn't impact everyone equally. And so on this graph, we look at these 2 metrics by race ethnicity. And we found that the Hispanic or Latino community are more likely to experience these 2 housing affordability issues. As Sarah mentioned earlier, this population is also more likely to be uninsured. So I think this is an example of where we see some intersection between a couple different issues that could impact people's ability to afford basic necessities like housing, because perhaps additional issues around medical bills that they might not be able to afford because they are uninsured. So we also know that housing issues may look different based on where you live. So we took the metric that shows those who said they had issues affording their rent or mortgage in the last year and looked at this across geographies in Colorado. So this map outlines those same 21 health statistics region and looks at that housing affordability issue across the state for those regions. Again, the dark blue outlines those who are less likely to be impacted by not being able to afford their rent or housing in the last year, whereas the lightest blue areas are those who are more likely to be impacted by this issue. So I just wanted to point out a couple areas. We saw that in Pueblo County and northeastern Colorado, they were more likely to report that they were unable to afford their rent or mortgage in the last year. And kind of next up, as we go through the I-70 corridor out to Mesa County, those are other areas that were more likely to report experiencing these issues. And again, we know that there are many economic factors that influence a family or person's ability to afford their home. And we can see here that it differs greatly based on where you live. So we will continue to track these housing issues and different affordability impacts on the CHAZ to really understand where Coloradans across Colorado are proportionally impacted by these different affordability issues.
The 23 CHAZ findings on food security really mirror what we have seen in some other recent national data, that food insecurity is on the rise, both here in Colorado, but then of course across the country. We measured food insecurity on the CHAZ by someone who said that they ate less than they thought they should because they could not afford it. So in 2023, the percentage of Coloradans experiencing food insecurity increased to 11.2%. That's a jump from our pandemic low of 8.1. And then we've jumped over our pre-pandemic rate of 9.6%. This increase comes in the wake of a couple of factors. One, of course, the change in SNAP-related policy following the end of the public health emergency, but also just more kind of prevalent to all of us, the increasing cost of food and groceries and how that impacts Coloradans. And it impacts Coloradans differently depending on where you live. Again, 21 health statistics regions. I want to orient you to this map primarily by pointing you to the key. So up here in our darker shade, you see that some of the lowest rates of food insecurity, 5 to 7.5%, are found in some of our Park Teller, Clear Creek, Gilpin, some of our Front Range counties, also up here in Northwest Colorado. But then as you move down the key and you look to the lighter shaded areas, you see that in some communities, they're having and experiencing food insecurity rates of 16 to almost 22% of people who live there. And we see that in the San Luis Valley, Southeast Colorado, and up north in Weld County. So again, pointing out that the state average, bless you, is important, but also really important to also see how that varies by community and just the differences. And we also see differences by other demographic factors, including gender identity. So Coloradans who identify as non-binary or other gender have a food insecurity rate of 18.2, which is twice as high as Coloradans who identify as male.
So this section will be our last section relating to affordability that we're going to be talking with you all today. And this one relates to how people are able to afford really important healthcare services. As we saw that more than 1 million Coloradans couldn't afford the healthcare when they needed it. So this first figure outlines those who reported that they were unable to get needed prescription care, general doctor care, or specialty care sometime in the last year. And we've been tracking on this issue since 2009. And as you can see, this has been a pretty stubborn, consistent barrier throughout the history that we've captured this metric. And we know that this issue doesn't impact everyone the same. So we're going to look at that 19.8% that we found in 2023 to understand more about who is more likely to be having issues affording the kinds of healthcare that they need. So first, we're going to look at this healthcare affordability issue by insurance coverage type. So I want to just highlight in that orange bar, we see that those who are not covered are most at risk, as over half of the uninsured reported that they didn't get the kinds of healthcare that they needed in the last year because of fear of cost. But just because you have coverage, that doesn't make you immune to this issue. As we see that next up on the list, those who have coverage through the individual marketplace, about a fourth of them said that they also experienced where they just didn't get the kind of care that they needed because they avoided it because of fear of those costs. So we know that many people have coverage in Colorado, but we still have this issue around them being able to get the kinds of health care that they need in the last year because of fear of cost. So we're going to look at this issue, but examine a couple more demographics to see how people fare in this metric. So this figure outlines those who didn't get the kinds of care that they needed because of cost by race ethnicity. So for example, on the left-hand side of this figure, I wanted to point out that American Indian or Alaskan Native Coloradans were more likely than other racial or ethnic groups in Colorado to report experiencing this issue, about 35%. So when we take this, compounded by other social factors that we know many individuals in Colorado are experiencing, it's no wonder that so many people are having to make really hard decisions about getting healthcare services because of this overwhelming need to also afford housing, also afford food. There's a lot of conflicting affordability issues that are impacting a lot of Coloradans and competing for dollars in people's pockets. So while cost is one of the main barriers getting in the way of people getting care, we know that those aren't the only reasons why people have issues getting the kind of care that they need in Colorado, meaning an even greater number of people avoiding going to the doctor's office because of these barriers. So let's take a closer look at some other barriers. So this figure will outline 4 important barriers to care that the CHAS also tracks on. The first of which is those who said that they were unable to get an appointment when one was needed. The second was those who reported that their doctor's office or clinic weren't accepting new patients. The third is my doctor's office or clinic didn't accept my insurance coverage type. And lastly, it's those who reported that they didn't have a way to get to the doctor's office or clinic, so they had transportation issues. So what we found was that all 4 of these metrics increased significantly between 2021 and 2023. So for example, I'll just point out for those who said they weren't able to get an appointment, that increased by about 10 percentage points between 2021 and 2023. So when we think about this in combination with those avoiding care because of fear of cost, this represents many Coloradans who are just, there's so much getting in the way of them trying to get the kinds of care that they need.
The CHAS also asks about Coloradans' experiences when they're accessing care, and which gives us some important insights and information as we are all working to make our organizations, our services, the communities that we live in more accessible, more welcoming, and more inviting. And when we look at the data on those who experienced disrespect in healthcare in 2023, it suggests that we all have a little more work to do in this space. So the percentage of Coloradans who experienced disrespect in healthcare increased significantly in 2023, a jump from 3.8% in 21 to 7.1% in 2023. So just under about 300,000 Coloradans. And let's learn just a little bit more about who is experiencing disrespect and why. So this chart shows all of the reasons that a Coloradan could select for why they felt they were experiencing disrespect. And I'll give everybody just a sec to take a look at it. I'll point out the top reason cited was age. So just under 40% cited age as a factor for experiencing disrespect. Just underneath that, about 35% cited income or financial situation, and then about 31% cited race. So our top 3 reasons that Coloradans cite for experiencing disrespect: age, income, and race. Just slightly lower than that, 29% also identified because of having a disability or some sort of a mental or physical or cognitive condition. And when we take a closer look at the age category, we see that younger Coloradans actually have a rate twice as high than the state average overall. So about 15.7% compared to 7.1. So again, an interesting finding, one that could be worth digging into a little bit more. Also, as Lindsay had shared earlier, there could just be different ways too that generations interact with healthcare and how they perceive working with providers. So there could be a lot of influences in the data on this chart today. So, okay, last one.
So this is our 8th and final topic that we're going to talk with everybody out today. And this was a new section that we added in 2023, and it's about long COVID. And we found that long COVID had some big impacts on many Coloradans. So first, these are 2 of the new questions that we added in 2023. The first of which on the left in yellow, this is those who reported that they tested positive for COVID at some point since the beginning of the COVID-19 pandemic. And we found about 50% of those 16 years of age or older said, yep, at some point I have tested positive for COVID. But for those who tested positive, we wanted to look a little bit deeper. And of that population, we found that about 14% of people said that they had experienced symptoms from COVID-19 for 3 or more months. And that 3 or more months period of time is how long COVID will be defined here on the CHAS. So we wanted to understand a little bit more about the impacts that this 14% had after testing positive for COVID-19. So this table outlines the different impacts that we captured on the CHAS of those who said that they experienced symptoms for 3 or more months. And this included things like they had to take time off of work or school. They had to take reduced hours at work. They actually had to leave their job, or they had to apply for disability benefits, as well as some other impacts that they could cite as well. And this really shows the big financial impact of individuals experiencing these long symptoms, as about 50% of these individuals said that they had to take time off of work, and another third of them saying that they had to take reduced hours at work. This represents tens of thousands of Coloradans who were financially impacted because of their long COVID symptoms. And so we wanted to understand a little bit more about this financial impact. So we took a couple of other affordability issues that we capture on the CHAS and compared it between those who said they had long COVID symptoms and those who said that they did not. So on the left, we looked at our unstable housing metric, and we found that those who said they had long COVID symptoms were about 3 times more likely to report that they experienced unstable housing. And when we look at food, it's a similar story. We found that those who had long COVID symptoms were about twice as likely to report experiencing food insecurity. And of course, this is a complex relationship, but definitely something to keep tracking on and understanding more about. So that wraps up our data section. And so, as Sarah mentioned, these data really emphasize a key theme of our presentation, which is this moment of truth. We saw changes in many affordability metrics that we saw improve a little bit in 2021, but then jump back up in 2023. For example, the removal of some housing protections, and we saw how that change in unstable housing dipped down in 2021, but then went back up in 2023 to match pre-pandemic levels. This year's CHAS gives us both useful and challenging data, but they also give us a place to start. So we must work with this information to understand what people are facing in our state, and these data will help inform where we might go next. We know that many communities are facing some significant challenges, and these data help us understand who they are and frame the conversation around them and their experiences, and hopefully point to some solutions moving forward. And I know you all are probably interested in lots more information and lots more data that we have available on the 2023 CHAS. So today we've launched a lot of stuff on our website. So I just wanted to highlight some of those data products. So we have some workbooks available, which outline a lot of the metrics we talked about today, as well as many others by both regional as well as demographic splits. So that's what's available, as well as a public use file. If you're interested in doing your own analysis, you can download a public data set and do some analysis on your own. We also have some profiles by those 21 health statistics regions, which are really interesting that you can download and look at, see more about your community in Colorado, as well as the actual chart pack, which outlines all of this information in a publication that will be available as well as different things about our survey sampling and methodology that you can find. And in addition to all of this data, we also have lots of stories that represent the individuals and people behind the numbers in the CHAS. So we have stories of people impacted by lots of things, and I think that's a very really important thing to check out as well. So we've kind of alluded to some of this. We have some stuff coming up that we wanted to highlight as well. We're going to be looking at the broadband access section, looking a little bit more at our oral health section as well as that LGBTQ+ health brief that I mentioned earlier, as well as understanding a little bit more about the relationship between our different sections that we have about culturally competent and relevant care delivery that we have available on the CHAS. So just wanted to highlight some up and coming stuff that's coming as well. And we're going to open it up to you all for some questions and some comments. And I have this mic so I can walk around and give it to you. Or we have the little mics, or Deanna also has a mic. Who has my first question?
We have a question from online, from the back of the room. Ada asked, it really seems like younger adults are struggling more, mental health cost issues, housing, food instability, feeling disrespect, seeking care. Could you provide a little more context around where those youth tend to be concentrated? Is this a Front Range problem or Northeast, Southeast, where we see more food and housing stability issues?
That's a great question. So we do know, at least from some of the analyses I've run in the past, we do know that age looks a little bit differently based on where you live in Colorado. Different parts of the South are usually a little bit older for their average age in Colorado. So I think that if we can look at that demographic across the state, you can see where there's a little bit younger people in the Front Range, a little bit younger people potentially in Mesa County. But yes, it's usually some of the more urban areas where there's younger people, but that doesn't discount the experience that people in rural settings are also having. I would say that while we might have more younger adults living in certain areas of the state, I think that this is a problem that's not unique to any one area of Colorado, as mental health is a huge issue that is impacting so many young kids, so many young adults that we know is just since 2021 hasn't changed a whole lot, unfortunately.
Hi.
Thank you. So I had a question about climate change and air pollution specifically. In our experience, we are noticing a high tick in air pollution being one of the social determinants of health for the elderly. So in your statistic, I think you said 61% were now facing asthma or lung induced illness. And I was wondering, do you have any age like breakdowns for that particular percentage?
So we do have that available. We haven't looked at it yet, but that is an analysis we can easily do with that metric on the CHAS. And unfortunately, because so many people have experienced that, we have a pretty large sample size of people that said that breathing related problems was an impact of climate change. I'm also interested in kind of the overlap between those who said they had long COVID as well as those with breathing problems because of climate. So that was an additional thing I thought of when trying to understand these different influences of this issue from climate change. But that is something we can easily do. Yeah.
Oh, perfect. Thank you.
Hi. So I have a question about the uninsured to then insured and how that might be, I guess, looked at further. So Omni-Salud came out last year, and there was a very large amount of people who obviously signed up for it, thankfully. And so is there a way for us to be able to know whether or not the people who signed up for the Medicaid, like actually said Medicaid, were saying Omni-Salud as well, or if that was considered maybe individual? Because I would like to know what the difference, what that gap made up.
That's a great question. We do not capture specifics around the Omni-Salud program, unfortunately, but we do have a self-reported metric about what other type of insurance you might have that I think would be meaningful to look into as a free response to see how many people actually cited Omni-Salud, because I've looked at that briefly and I do know some people did cite that. So we could see a little bit about some qualitative research to see how many people reported that.
Yeah, my concern is that whether or not they know that might be
Right.
either identified under Medicaid or that would be considered the exchange.
Right.
It's technically, I'd say.
Yeah, that's a great point.
I get to use this. Sorry, I'm waiting for a microphone. So as always, a fabulous report that has more questions than answers. To get back to the fundamental one, the two questions on the insurance, and one of them is going to be very wonkish. I'm sorry. The first is the breakdown by kids and adults, which isn't in here as best I can tell, looking through the report either. Did kids also drop like that? There was some stuff in the last report about Latino kids' rates of uninsurance going up, and I was very curious to see if that trend had continued or not. So that's one. And then the second question is about the cell size question. I was a little confused. Generally, you exclude a cell size when the denominator is too small. Does that mean too few people in those counties answered the question, or you were excluding because the numerator was too small?
Yeah, I'll take that first one. So we actually excluded because of the numerator issue. So we have captured information across the health statistics region of about 400 people for raw sample in each one of the health statistics. But we use the residual standard error issue to understand if a numerator is really small, how representative of that population is it? So that's an additional kind of exclusion criteria we use. Because we want to make sure we provide what we feel representative population estimates are for different metrics. But thank you for that question. Yeah.
It could be a 0 with big error bar. Anyway, and then, but about the kids, did you see that, or have you looked at that yet?
So we didn't publish on age combined with race ethnicity in this chart pack, but that is something that we can easily look at as well for this one and see how, if it was impacted. Based on the overall rate, I feel like we could speculate that we might see a similar drop for those kiddos living in those families, but we can look into that to see the exact rate of those Hispanic or Latino youths in Colorado.
The number of Coloradans reporting poor mental health is striking. Is there nationally comparable data that you can look at to see whether our problem is trending with the country or worse? I assume it's not better.
Yeah, I feel like this is a ubiquitous problem that's impacting lots of people across the country. And there are some national substance use and mental health surveys that we can compare our results to, like the National Survey of Drug Use and Health. That would be a data source that we could look at for some of these behavioral health metrics and compare it to the CHAS to see how we compare to different states or if it's a very similar story. Yeah.
Another online question, if you would, from Sarah for Sarah. If you had a magic wand, where would you put your energy in public health programming based on what you're seeing? Just a simple question for you.
Is Carrie, you want to bail? I mean, public health is policy. And that's where, and that is not a magic wand. And that is evidence-based, and doable. And we've done it. So that would be where I would start, and what I think the CHAS really points us to. That's how we respond as a state to address some of these significant and increasing challenges that are facing Coloradans, but also the providers and the individuals in those communities who are trying to take care of them as well too. So I think we have time for one more question. Is there anybody in the room who wants to, in the back, you get the last question. Excellent.
Good morning. Thank you for all this. And my question is probably entirely not formed yet, but I'm interested in the new measure, the new metric around healthcare or quality of health and the intersection to climate change. So, and maybe this is just showing my projection, but I feel like there's a lot of awareness and scientific data that have been, presented to the public generally in the past few years. And especially in our state, there's just increased awareness on the impact of health. And so, but within the sample of your respondents on the question, do you have any insight on the extent to which, there's this kind of a ramp up of the awareness, but also the data around health and health impacts, due to climate change is still new and still evolving? So do you have any insight on that as far as next steps? Are we going to continue to track this metric? And how can this be used, for policy, for programming, so on and so forth?
Yeah, thank you. I'll go first. I'll start it. Part of the reason why we added the question on climate and health in the 23 CHAS was really just to what you acknowledged, that it's an increasing issue. We are experiencing it very close to home. Very close to home. And I think we also at CHI have been doing a fair amount of work over the last several years, really trying to understand the connection between climate and health. And we have developed a climate action team called Acclimate that involves state and local partners and community members from across the state really coming together to think through what are the policy actions that we need to take to be able to respond to our changing climate. And how do we do that together? Across both at the state level, but also what can we do at the local level? And I think the CHAS data 23, I know that we will be doing some deeper cuts into those numbers because we have, as Lindsay said, a big sample, for better, for worse, but also being able to do it again in 2025. The 2025 CHAS starts today in some ways because we want to know what comes next, and we want to be able to measure the impact of what we do as a result of what we've learned today. So that's one of those issues that we look forward to continuing to trend over time and hopefully see some changes as we have seen in some of these data points over the years. Okay, thanks for the question. All right, I think with that, if you're in the, no, maybe not. Okay, well, I think there's an evaluation of some sort for providing feedback, but I don't really know what that is. So we might email it out to you, but please be sure to pick up your chart pack. If you're in the room on your way out, we have them in English and Spanish, so you're welcome to take what you need. And again, I just first want to thank my colleague Lindsay. I want to thank our team CHI in the back for putting this all together, and really to all of you for coming out this morning, for joining us online, and for just being in it with us. Yeah, it's great to be in partnership with all of you. Thank you so much, and enjoy the rest of your morning.